Good morning, warriors. I want to welcome back James Vitale, acupuncturist with Suffolk County Acupuncture. He has offices near St. James. Is that correct?
Yes.
In St. James. First of all, welcome back to our show. Tell me a little bit about acupuncture. Take me from the beginning of where someone is supposed to start when they're going through the fertility journey.
Great. Well, again, I want to thank you for having me. I really appreciate the opportunity to talk to you and your Facebook group. I think it's a wonderful thing you're doing, and I'm happy to share my information regarding acupuncture.
Always a pleasure having you.
Thank you. So, to answer your question, when is a good time, or when someone is experiencing, when a couple is experiencing fertility challenges, oftentimes, they're kind of, at the mercy of the MDs and, oh, what do we do? And now acupuncture has become very popular in the fertility realm because its ability to correct imbalances in hormones and menstrual cycles. Acupuncture offers a wonderful opportunity to improve health, blood flow to the uterine lining, to reduce stress levels, to balance hormones. There are many things that acupuncture can do. So I often tell patients, when is the best time? Well, as soon as possible, depending on where you are in your fertility journey. If someone is early in the journey where they're just starting to try and have problems, that's great. Go get tests by the doctor, go get fallopian tubes checked, get your hormones levels checked, get sperm semen analysis checked. Make sure you know exactly what's going on. And then start with acupuncture as well. Weekly sessions is enough to just get your stress levels low, get your blood flowing, balance out your hormones, and basically start to create health from within.
Do you suggest this for the male partner as well to be going on a weekly basis, or is the same time frame as a woman going through this?
For men, it's a little different, but it definitely is beneficial. It's often harder to get the husbands to come in. I often try to consult with the couple, not just the woman, because male factor is 50% of the equation. Oftentimes that's overlooked or that is just assumed, well, his numbers are fine. Well, there's different levels of fine. So I often encourage the men to come in or at least do a nutritional and herbal consult with me. Supplements are very good for improving male factor. And if there are nutritional deficiencies, if there's stress, and I often counsel the men they might be doing things that are harming semen factors. For example, if they're eating the wrong foods, if they are consuming energy drinks. The Red Bulls and the Monster energy drinks have been proven. Studies have shown that they lower sperm count.
Sometimes I feel the male factor is so overlooked. When doctors throw out unexplained infertility, maybe we're kind of going over the male factor and we're kind of taking them out of the equation when maybe we should be looking at the male factor, our eggs that are not good.
It's often a dance between the two. Yeah. Well, it really is overlooked. And because for some reason the doctors think, well, men make millions of sperm every day. So as long as their count is within a normal range, whatever that is, and as long as their morphology and motility are within normal range, then it should be fine. But it's not because that number is constantly getting lowered. In the last 20, 30 years, testosterone levels and counts have dropped. It used to be considered 50 million were normal. Now 10 million is considered the new normal, which is a scary thing for men's health because society, industrial, environmental toxins and lifestyle changes and nutritional changes is creating this perfect storm of sub-quality sperm. If the woman has good eggs and uterine lining, but the sperm is not good, it may not form an embryo, may not fertilize, and if it does, it may not implant because of not healthy enough sperm. Male factor is very important. I often encourage them to come in for at least a consultation. Weekly sessions would benefit them, but the nutritional support is most important for men.
And I think that's what's missing. Maybe a lot of people in the group, if you have unexplained infertility, and if that's what the doctors keep telling you, maybe you should say, hey, wait a minute, my husband's never really gotten tested. Maybe we both should see a nutritionist, and maybe it's not just on me.
Right.
maybe he's got to find something to work with and go see a doctor. I know it's not always easy.
Then gradually you go, and you don't want to admit they might be the problem. So
Right.
I often have a heart to heart with them and saying, listen, step up. If your wife is going through injections and all the testing, the least you can do is get checked and start taking some good vitamins. That's the least you can do to contribute, because even if their sperm parameters are normal, we'd like to be better than normal. We would like to be above average, because the healthier you are, the healthier your spouse is, the healthier baby's going to be. So you owe it to yourself, you owe it to your spouse to to really step up and do what's right and be part of the process.
I want to take us to the 2 week wait. A lot of people in the group and a lot of people I speak to often come up with questions during the 2 week wait. Is it okay if we go out one night and have a drink or two? Or is it okay if I go out dancing? I had tickets to go to Disney. Is it okay if we walk around or maybe go on a ride or two? Give me your opinion on that 2 week wait. What should people be doing in that time period that's healthy and that kind of builds the right bed, so to speak,
Right.
that egg to stick?
That's a great question, and I'm often asked that too. I often will treat through the 2 week wait, and it's a stressful time, as you know. The 2 week wait is very, very stressful, and especially for someone going through for the first time, either through IUI or IVF, it can be nerve-wracking, because every day you're like, oh, did it work? Did it not work? And your mind it can be your own worst enemy, unfortunately. So I usually encourage one. You want to be gentle with your body, but you don't want to be bed rest unless the doctor recommended bed rest. That's a very rare occasion. Usually day-to-day walking, day-to-day activities fine. But again, you want to be somewhat gentle, and you don't want to overdo exercise. Just keep it down to walking, because you want to keep your inflammation levels low and you want to keep your stress levels low as much as possible. So yeah, going to roller coasters and amusement parks, probably not a good idea. Alcohol, my opinion about alcohol is, until you've done the ovulation or until you've done a transfer, alcohol is okay in moderation. We've been drinking alcohol for centuries, and I don't think it's caused a problem with fertility. But alcohol is a lot of sugar, and it does create a little bit of a shock to your system every time you have a drink. So during the 2 week wait, you want to assume you're pregnant, and you don't want to consume any alcohol while you're pregnant. So I say during the 2 week wait, if you can abstain from having a drink, it's probably better, even though it might have a stress relieving effect. Leading up to that point, having one or two drinks a week, you have a clean drink, so either wine or a clean spirit, like a vodka, something like that. I don't recommend beer. Beer is very hard on the body, creates a lot of inflammation. So I usually encourage
Does.
discourage.
That's
Yeah,
interesting.
beer is very inflammatory. It's all wheat, and it creates this wheat belly that you want to, it's a shock to your system. So I often encourage a good quality wine or a good quality alcohol, but in moderation, one, maybe two a week, and that's it but then during the 2 week wait, try and abstain. The activity level you want to keep during the 2 week wait is just, walking is your best friend. Go for a good half-hour walk every day, if possible, outside on a beautiful day like today would be great. There are three things, though. That's great. I'm glad you brought this up. So when I work with a couple, work with the patients, I usually give them three tips that they can do to make the 2 week wait a little more successful, better chance for success. The first thing I recommend is an old wives' tale that sounds silly, but it actually seems to work.
McDonald's French fries.
Not the
Everybody
French,
loves the
that's
McDonald's
one
French
thing.
fries.
I really have a thing against McDonald's in general, that it's the worst of the worst. You just don't want to shock your body, but the salt, they say, may help.
What is it about the salt?
So sodium, the sodium is an electrolyte. And so electrolyte is what creates electricity within the body. So having the right balance of salt is important for health. But what they use in McDonald's French fries, is far the toxicity of the fries and preservatives and everything else far outweighs the potential
The
benefit of
potential
salt.
benefit.
My thing is pineapple, including the core. It sounds like a crazy old wives' tale, but I've seen it work with many patients who are having just a little bit of pineapple every day from the day of transfer or from the day of IUI. And for about 5 days during your implantation window, a little bit of pineapple, including the core, every day for 5 days can't hurt. It can only help because they feel that the digestive enzymes, the bromelain, potentially can help control inflammation, which can help with implantation. So, 2 or 3 pieces of pineapple a day, little triangles, including the center hard part, every day for about 5 days, can't hurt and it can only help.
My mother used to go to the grocery store, and when I was going through this, she would drop off containers of pineapple and the pineapple core every day. She's like, "Here, eat this."
That's great. Not too much though. I do want to emphasize not too much because pineapple has a lot of sugar and
Right.
excessive sugar can negatively influence the body. A few pieces a day every day, that's great.
Nutrition during that 2-week wait is so vital
Yeah.
because in some respect, you're making a nest
Right.
for the
Right. You
baby.
want to have foods that are going to help nourish the uterine lining. You want to eat the lining thick and receptive, and you don't want to eat foods that shock your system and potentially create an immune response because autoimmunity is an important thing to control. So, yeah, keeping your diet healthy, stay away from fast foods, alcohol, anything that's going to create inflammation that could potentially be detrimental.
Some of these fertility clinics don't really push nutritionists. I think it's so important. All these pieces of the puzzle, if we really put them all together, I guess they would be out of business. But having all these pieces together, I think would benefit more than anything else.
It's unfortunate that the medical community, not just in the reproductive world, but all doctors, really don't have a grasp on nutrition. I'm friends with many MDs, and they'll tell you in medical school, they had maybe 4 hours of
Believable.
nutrition education in their entire training. And it's been emphasis is mostly on pharmaceuticals and illness, not health. When they consult, they don't have time to do a dietary plan with somebody, even if they knew it, because they have so little time to spend. So their niche is very narrow. Hormones, it really is up to the individual to seek out that nutrition advice elsewhere. Years ago, doctors understood health and nutrition, but today, unfortunately, they don't. So that's where, alternative people, so, acupuncturists have a very strong grasp on nutrition. Nutritionists, naturopaths, all this alternative medicine or integrative medicine should be part of your team. I think that's a very important missing part of the puzzle because what you eat has a strong role in health and fertility.
What about the supplements that a lot of acupuncturists recommend to take? Sometimes it scares people and they feel like if I don't take, whatever they're trying to say, oh, you have to take, certain supplement to, and if you don't take it, you're not going to get pregnant or, acupuncture won't work. Do you have to take these extra supplements when you see an acupuncturist? Can you just get the needles done? Tell me a little bit about that.
Sure.
It's scary for a lot of people.
It is scary, especially herbalists. So there's a couple two different categories you want to consider. There's nutraceuticals like Western supplements like CoQ10 and vitamin D. Those are basic nutrition that everybody should have. Unfortunately, because our food supply has been so drained of nutrients, we do need to supplement with nutraceuticals. So I make sure my patients all taking enough vitamin D3, magnesium, CoQ10. All of these are supplements are extremely important to make sure you have because this is your root base health. If you don't have good vitamin D, you're not going to be able to really move forward in your health. But then there's the herbal realm, and that's where the questions come up. And there's a lot of misunderstandings about herbs.
Yeah.
And a good herbalist will be able to identify if somebody's body is unhealthy and that a certain herbal pattern or formula could correct this imbalance in the body. Many MDs don't have any awareness of herbs at all and just say, don't take any herbs. I agree that I don't do herbs with a patient when they're on a medicated cycle because herbs can potentially counteract their hormones that they put you on. If you're on Gonalef or Follistim, putting you on an herbal formula that can influence hormones may counteract that, and we don't want that.
There are practitioners that preach that,
They're
which
adamant.
drive me,
Yeah, yeah.
which get me so angry because it's not helping them. You're hurting the people that want the help.
And that's the herbalist who kind of, they are so adamant in their what they know that theirs is the only way. There's no flexibility. And I don't work that way. I think you have to really know who you're treating and see where they're at. If I have a patient who's in between cycles or they're not doing an IVF medicated round yet, they just want to bounce and they're open to it, fantastic. But if they're not willing, if they don't want to do herbs, that's fine. We can work with diet, Western nutraceuticals, vitamins, and acupuncture by itself is very powerful in reducing stress, improving blood flow, and balancing out the hormones. And those three factors alone are so important. Herbs are good, but if you hit someone over the head and force them to take it, it's just going to backfire.
Right?
So
It's not going to work.
not going to work because they're going to have a negative feeling about taking it, and it's just going to create more stress than anything else. I try and encourage that if they are willing and want to, and they're not in a medicated cycle, and they want to do it, fantastic. It can help, but we don't force it. We work with them, not against them.
So when somebody starts with you, take me through the beginning. They come into your office, you have a consultation with them, you go over everything. How long do they stay on a table for? What's an actual appointment like for
So
someone?
the way I do it is for when I'm consulting with a fertility patient, I always do a Zoom consultation first. It's about an hour long. And we do a deep dive on every aspect of their health, of their lifestyle, of their diet. I want to know, what they're eating, how they're sleeping, how
Right.
their bowel movements are, how their menstrual cycle is, what's, their home environment like. Do they live in a moldy house? What does their spouse do? And we do a deep dive, and I do a very detailed nutritional analysis. I want to know, what are you eating for breakfast? What are you eating for lunch, dinner, snacks,
Nobody
drinks?
did this with me.
It's unfortunate because,
Nobody did this with me. You
yeah,
literally went into an office, I went on a table, that was it.
and then some acupuncturists aren't fully trained in the nutritional aspect and the lifestyle aspect. Many, especially some new ones who are, they say they treat fertility because they took a class in school, but
That was
really
basically what they
true.
learned.
Yeah, that's a lot of that. So my suggestion is to your viewers here is that, vet out your acupuncturist. Ask them, what training have you had in fertility? Have you gone for continuing education? There's a lot of good education out there for acupuncturists to expand their knowledge.
How did you get started on the fertility niche?
That's a good question. I'm often asked why, as a man, why am I so passionate about treating fertility? And it's through my own personal experience. I've been licensed since 2001, so I've been doing this for 23, 24 years. And when I first graduated school, my wife and I were newly married, and we wanted to start a family. I started off as a general practitioner with a sports medicine background. I was very active in sports, and mostly pain management in sports was what I was working on. But my wife and I were trying to have a family and it wasn't working. So she went and got tested and turns out she had a blocked fallopian tube. So she was devastated. She's like, oh my God, it's just, I was like, don't panic just yet. And I went to the
Mhm.
books, my teachers, took some classes and did some strong acupuncture. I did an herbal consult and all these things with my wife and I worked on her for a good 3, 4 months. Before you know it, the tube was unblocked and she was pregnant naturally. We were
Unbelievable.
very fortunate that it worked. And that's kind of what got me started. It's like, wow, if I was able to do this for myself and for my wife, if I can do this for others, what a wonderful gift this would be to others.
It's such a wonderful gift to be able to do what you do and to help the people that you help. It really is.
Very rewarding. That's why I truly focus on fertility. About 60% of my practice is fertility. It is so rewarding. Yes, I can help somebody's back pain, I can help somebody's headache, and that's great. But when I can help a couple have a family, that's the most rewarding experience in the world.
Now that marijuana is pretty much legal, give me your thoughts about marijuana.
Cannabis is legalized. It's not without its risk. Even though it's a legalized drug, just like alcohol, it's not good for your body. It's not healthy. A little bit of CBD, which is a component of cannabis that doesn't get you high, can potentially have a therapeutic effect of reducing inflammation and calming the body because the body has receptors, cannabinoid receptors. I, recreational cannabis, recreational THC marijuana, I still feel that it's a drug that has harmful side effects. So Even though it's legal, doesn't make it healthy, doesn't make it good for you. So tread with caution. Especially in men, it's been shown to reduce semen analysis, sperm levels.
If
So
you
it's,
are a smoker, because many people are now, even day to day,
yeah.
it's best to stop maybe 3 months out of your fertility cycle.
And especially if you're taking it through like smoking or vaping, like if you're lighting up a joint, or if you're doing old
Right,
school where now it's edibles and you can get gummies and things like that,
right.
it's still best to really uh,
Abstain for a period of time prior to starting.
yeah, exactly. Because it's a drug that has a harmful side effect, even though it's legal. And you want to be as healthy as possible. So you're healthy, your spouse is healthy, and you create the healthiest baby you can. Give it 3 months off. Find your stress relief in different ways.
Right.
That's why many people do it, because it reduces their stress levels.
It's so out there and it
Yeah,
has to be talked about because for so long it wasn't talked about.
right.
And, it's frustrating because I know the stress level is there for those
Yeah.
2 weeks, and not even those two, for this whole time period.
The whole
All
journey.
the
No stress.
journey, even
Yes.
post journey, it's stress. It's
Yeah.
all stressful. I
Yes.
mean, it is what it is. But I think it's important to know that you're creating a nest and you want to make that nest as healthy as possible before you're putting in that embryo. And
Absolutely.
that maybe as stressful as that 2 week wait is to want to have that one glass of wine or that one cocktail, then maybe to wait a minute. Say, you know what? I want to have everything nice and clean.
Yeah. You owe it to your future baby to be
You
as
owe it to for such a short amount of time that you have to deal with this. Those 9 months, 9, 11 months. To me, I think it's, prioritize.
exactly. It's a choice that you really should make the right choice for the sake of future generation. Absolutely.
And it seems
So
so many people, they'll say, oh, it's okay. And you always hear that.
it's not just okay. They want it to be just okay.
Right, right.
But the
Exactly.
evidence shows, I can show you studies upon studies that show the detrimental effects of cannabis, marijuana, alcohol, and it's just not helping. You may get immediate relief, but then it's going to create a lot more inflammation and a lot more damage down the road. So thank you for bringing that back up. Coming back around to the 2 week wait conversation. When there is a lot of stress, there are a couple of other things I like to encourage
Right. You had
men
other
to
tips.
besides getting weekly acupuncture sessions during the 2 week wait, which is safe to do with the right acupuncturist who knows how to treat that. First one was pineapple, we talked about.
Right?
Second one is doing some guided meditation. Guided meditation is actually very powerful. So Reiki is an energy healing, which is wonderful too. If you can go to a Reiki therapist, go ahead and do Reiki. But something you can do yourself on a daily basis is guided meditation. And it's not meditation where you're sitting, closing your eyes and trying to think of nothing. That takes years to get good at and just creates stress. So I don't recommend that. But when you listen to a pre-recorded guided meditation where you're listening to somebody's voice, who's putting you through a progressive relaxation. They're telling you to close your eyes and count backwards from 10 to 1 and imagine you're on a beach. The ones that are really effective are the ones that paint a positive picture. So you want to see your uterine lining thickening. You want to see the embryo growing. You want to see it developing legs into the uterine wall. When you hear a meditation that puts that visualization in your brain, and you do it regularly. My recommendation is every day for 20 minutes, do a guided meditation. There are some great ones out there. My favorite one is a company called Circle and Bloom. They make pre-recorded ones you can stream from their website, detailed and specific to where you are in your cycle. The more often you do that, the more your brain goes, oh, this is real, and starts to act accordingly. Your brain doesn't know the difference between a vivid imagination and reality. So the
Okay.
more you can see that positive picture, the more your body goes, okay, this is how it is, and it starts to believe it. And that will help reframe that negative aspect of, oh my God, it's not going to work, it's not going to work. No, no. You see that positive picture, and
Gonna
more
work.
you see it, it more chance of it working. So that's the second one. So Circle and Bloom, there's a
Okay.
great app on the App Store called Mindful IVF. I like that one too. That's inexpensive on the App Store. Or if you go to YouTube, there's a million free ones. If you
For
just go
meditation.
to fertility meditation, you'll find a million free ones that are really helpful. The third thing that really can help the stress levels is something called laugh therapy. Have you heard of laugh therapy? So it's exactly what it sounds like, laughter as medicine. Studies have shown that good hard laughter is as beneficial as a half an hour of meditation because when you truly laugh out loud, your body floods with a cascade of positive hormones like oxytocin that counteracts stress hormones like adrenaline and cortisol. It brings down those stress levels. So my recommendation is always keep your mood as light as possible and flood your body with humor. Watch a lot of comedy. On Netflix, watch all the comedies you can. When you're watching TV, if you're in your car for a long period of time, put on the comedy station on Pandora, Spotify, and really get yourself to laugh out loud. Because if you're able to laugh, your mood instantly changes and you don't feel so negative. Flood your body with humor and lightness because it's a heavy 2 weeks. Stress is huge.
From everything that you're saying, it seems like that's something that's also kind of forgotten about because a lot of these clinics, they only say, oh, go see a therapist one time. To me, I think it's so vital in this journey, mental health. And I think that's also another piece of the puzzle that if all these pieces were finally put together, people would have a much better chance of being successful.
Absolutely. It's a team effort. It's a team effort. When you take a holistic approach, not only are you getting your embryo transfer and hoping, but you're eating the right foods that aren't going to inflame you, you're controlling your stress, you're doing some physical activity that's going to help. Acupuncture reduces stress levels too. During the 2 week wait, I like to treat specifically to reduce stress and improve implantation. Laughter and having the right mental attitude go a long way to making the 2 week waits more successful.
Do needles hurt? Because that's what everybody asks.
Yeah,
One
that's
of
a
the needles.
question.
I was afraid at the beginning to go through that, but then when they were doing it, I'm like, oh, you don't really feel much.
Right. Yeah, exactly. So when it's done right, it shouldn't hurt. The most you should feel is just tiny little mosquito bite, if that. It should be just a tiny pinch, and that's all you feel other than a relaxation hit. The needles really are thin as a human hair, and they should not be uncomfortable whatsoever. And as anybody who's been through the IVF process knows, those injections you have to do for yourself are 10 times worse than an acupuncture needle. The needles we use are literally thin as your human hair. Very, very tiny. And you
Oh,
you
wow.
don't even feel it.
Can you show me that needle? Is that an example of a needle?
Yep, this
Example
is
of a
an
needle?
acupuncture needle that we would
Okay.
use. This is a very common acupoint that every acupuncturist uses
Oh,
all
I
the
love
time because
this.
it's so
Okay.
powerful. Just tap a little needle into it. And we give it a little stimulation. The patient should feel just a tiny little tingle, not even pain, just a little tingle. And that's basically getting your nervous system to relax. It's improving blood flow, sending signals to your brain to release endorphins, and getting your whole nervous system to go from fight or flight into rest and digest mode. And that's where the power is.
How does this get paid for? Do you take insurance? Is acupuncture covered?
So, acupuncture, fortunately, is accepted by many insurances now. Many insurances do cover
Oh, wow.
acupuncture.
Because I know 10 years ago, most of the time it was out of pocket.
Yeah, the insurance plans now recognize the value that when someone gets acupuncture for anything, it actually helps save the insurance company money. So if we can prevent the surgery or something like that, they are actually healthier and need less insurance services.
So
Well,
people shouldn't be afraid to go down the acupuncture route. They should call their insurance company to see if it's actually get covered. Don't automatically assume it's not covered.
right.
And
If
I think a
the
lot of people think that it's not covered.
Definitely check, and if your acupuncturist does have them verify for you. If they're accepting insurance, they would know whether you have coverage or not. They can do that for you if they accept insurance. So yeah, I would say a good, 50% of my patients do have insurance that cover. Again, I'm treating the side effects, usually the headaches and the back pain that go with what they're getting through IVF.
And what are your hours at the office if somebody wanted to give you a call? When is your office open? What areas do you cover primarily?
So I'm in Suffolk County, so we're right in the middle of Suffolk County. We cover the whole Suffolk area. We're there Monday through Saturday from noon till 8, almost every day. And not
Those are
Sundays.
nice hours.
Yep, it's myself and an associate that works with me. She's been with me for years.
Oh,
Yep,
okay.
yep, she's great. And yeah, we're there except Friday. So Monday through Thursday and then Saturday.
Is that something they could reach out to you on?
Absolutely. And in fact, I am on call for day of transfers acupuncture. One of the original studies done in 2002 was that acupuncture done day of transfer, just before and right after, showed a 30% improvement in success rates. So if you get acupuncture on the day of your transfer, just before, then you go get your transfer, then you come right back and get another acupuncture session right after, you'll see a 30% higher chance of success. And many studies have shown that over the years. So I am on call for that. So anytime someone has a transfer and they're close to all the major centers, Melville and Comac, where the big centers are, they'll come to me first. They'll go get your transfer, come right back. So I am on call for that. I've been there on a Sunday morning at 7 a.m. sometimes doing that pre and post.
Well, tell the Warriors, how can we get in touch with you? What's the best phone number to reach you?
Great. So my website, suffolkcountyacupuncture.com. The phone number is 631-656-6161. And please feel free. We do a free consult. If anybody has any questions, we do a 15-minute free consultation to just discuss the case and see if it's right for you. But I'd be happy to answer any questions anybody has.
We're happy to have you back with us. It's always a pleasure speaking with you and talking about acupuncture because I know it's helping so many people. Please come back with us again.
Absolutely. It was a pleasure. Meredith, thank you so much for having me
My
again and
pleasure.
allowing me to speak to your team. And again, I just want to say, what a wonderful thing you're doing by
Thank,
supporting all these people with this group. It's such a wonderful resource that I don't know
thank
what
you.
people do without it. Where else can you go to find your tribe of people going through exactly what you're going through? It's wonderful.
I appreciate that. Have a wonderful Saturday. Enjoy the rest of your weekend, and we'll speak again soon.
Thanks, Meredith. Take
Bye.
care.